the last decade or so, the whole training program has kind of moved away from fixed cardiovascular training to, well, what we have today, and it is why it's so important to be talking here about a paper in the March 31st issue of JACC, the American College of Cardiology's InTraining examination, a robust assessment tool for fellows, training programs, and the cardiovascular community. This is an editorial comment, and I have Dr. Douglas Drachman with me, who is a Director of Cardiovascular and Interventional Cardiology Fellowship Programs at Massachusetts General Hospital in Boston. First, how has the fixed curriculum changed in recent years?
Thanks. Well, the curriculum has just totally been renovated over the past, say, 10 years or so in cardiovascular education. Once upon a time, people could attend a learning program, and just based on the dwell time, if you spent a certain number of months in a program, you would be considered certified to have graduated from that program. Of course, there were examinations that one would have to take. You'd have to answer questions accurately in order to pass. But really nowadays, as a program director in a cardiology fellowship program, we're held accountable to assure that the learners are able to do or perform certain procedures, express certain medical knowledge, or demonstrate certain clinical skill sets. And increasingly, non-clinical skill sets are being emphasized as well. So really, the accountability or the ability to demonstrate that someone is actually able to fulfill these responsibilities has become to the forefront.
I mean, for doctors, ongoing education is critical for their entire career, so that this is now starting pretty early on. Talk about the ACC's InTraining examination for fellows.
Yeah, so the InTraining examination is a wonderful new tool that we have to assess our learners' performance, especially with respect to medical knowledge and some clinical skill sets. And what this is very much based on the paradigm of the ABIM's certification examination. Now, the American College of Cardiology and members of the ACC have developed a robust InTraining examination where we can administer this to fellows in training and see how they're doing kind of mid-stride, if you will, within their clinical experience. This has many potential benefits. There are opportunities for the learner themselves to identify where areas of gaps in their knowledge. And because the InTraining exam questions actually track to each of the clinical competencies that have also been developed within the American College of Cardiology, a learner can identify very specifically, based on questions they answered incorrectly, what areas of knowledge they need to develop further. And so it's a very important reporting tool to the learner themselves.
Now, your editorial comment is relating to another paper in JACC, the Cardiovascular InTraining Examination Development, Implementation, Results, and Future Directions. Can you talk about that paper for just a moment?
Yeah, so this is a wonderful paper that is one of the first publications based on the outcomes now of the InTraining exam. And the lead author Jeff Kuvan, and his associates have really demonstrated very, very well that the InTraining examination is robust. Namely, if a first-year fellow takes the exam and a second-year fellow takes an exam and a third-year fellow takes the exam, you can chart really the acquisition of knowledge that increases almost linearly from year to year to year as people acquire better knowledge. In addition, those individuals who tend to do less well in specific areas of clinical focus may have a harder time with the majority of questions within the exam. So it tends to track reasonably those who are more competent and those who need to kind of work on areas of deficiency. In addition, when you track within an individual how they did in their first year of fellowship, how they did in their second year of fellowship, and how they did in their third year of fellowship, we suspect that this will also track accordingly, that as one develops greater knowledge, one scores better on the exam. So it's very robust, internally consistent, however you want to say it. It really tends to show us what it is that we're looking for, namely, how well has someone mastered the knowledge base within cardiovascular medicine.
So, I guess finally, what are the potential advantages of adopting this particular program, for training program? And that's not only to the trainees, but also the greater cardiovascular community and the people who are going to come to you and say, let's put this program together.
Yeah, so that's an incredibly important question, which is first, the learner can identify their areas of knowledge gaps. Myself, as a program director in cardiovascular medicine, I can identify if there's an area where my fellows in my program are struggling with one particular topic area. It might influence me to change the educational paradigm that I have at my own institution. And this can be expanded actually to the greater cardiovascular society. As we learn from years and years of the administration of this examination, if there are areas that our fellows are not quite learning as well throughout their training program, we may actually develop educational curricula throughout the cardiovascular society to meet this need.
Well, this is why it's so much fun to deal with the ACC for so many years and all the news, because it is changing and it is always interesting. This pair of papers happens to be in the March 31st, 2015 issue of JACC. please look at that, and of course all the rest of the coverage from the ACC 2015 meeting in CardioSource World News, where I am Executive Editor Rick McGuire.